Denver. Good morning, John.
Hey, good morning, guys. So Stephen Fife is joining us. He's the executive director of Eskaton there in Fair Oaks. Good morning. Thanks for being with us.
Great. I'm glad to be here.
So I want to talk about this because this was, I guess, controversial to some folks at the beginning of bringing in COVID-19 patients to your facility. But if you can sort of lay out how the whole system has worked, the precautions that have been taken, and the care that these patients have been given.
Sure. Great question. So this was developed, so just to give a little background, our program was developed in partnership with Kaiser and at the encouragement of public health to provide a place for stable, positive COVID older adults to have some place to rehabilitate. And so we did get a little bit of pushback on the safety of that decision, but I think that the steps we've taken really have laid those concerns to rest. So what we've done is that we've taken a unit of our one wing of our short-term unit, sealed that off completely, established one entrance and one exit where the staff can come and serve those patients. Now those are dedicated staff. These are staff that are not going into the main building ever. They stay in that one unit. All the services are separate and don't ever, track back into the main building. So it's very safe. It's very independent from the rest of the building.
And where would these patients have gone otherwise?
So that's a very good question. That was a space that we felt like that we could be helpful. Because there's not really a place to go. There's a lot of skilled nursing facilities around, but they really are not set up to take, positive COVID patients from the hospital and see that they get the rehab they need. And so we thought that this is a way that we could give back to the community, that we could serve the elderly in this way.
And how many do you have there now?
So currently, we've had as many as 4. Right now, we're at 2 patients in that unit.
And what about the employees? How do you go about protecting all the people there that take care of those folks?
Yeah, great question. So that was a number one concern for us. We made sure that we have all the personal protective equipment that they need. We have plenty of that on site here, and they have that at their disposal. So we don't have concerns that way.
That is very good. Hey, Stephen Fife, thank you so much. We appreciate you taking the time this morning.
You bet. Thank you for having me.